as well as having the loose larvae that we just put on you a moment ago, the loose maggots, we can also put them in these little bags. And within the bags, the larvae can still feed and help to heal and clear a wound, but they can't escape. So do you feel better about having those on your body than the free-range maggots?
I can't really feel it, to be honest. Is it as good? Is it as effective? It doesn't look like they're all sat at the top of the bag. Don't you want them to be on the skin?
Yes, and obviously with the bag, like with the loose larvae, they would be very well sealed onto your wound, but they would then be able to feed through the bag. So it's no problem. If they'd found an area of necrotic tissue or infected tissue, they would have happily travelled down to it, and they can do that through, they can feed through the bag, so that's not a problem. Whether free-range larvae or bagged larvae are more effective, clinicians prefer different things. Certainly on a wound that's in an awkward site, like a heel or an elbow, then I think the bag doesn't work very well. You might need to have free-range. But if you've got a nice area where the bag can sit and be stuck down quite well, then it's easier to use. And certainly patients prefer bagged larvae.
You said they'd find the necrotic tissue. How do they do that? They smell it or taste it? Or?
It's just the smell of dead tissue that they love.
Okay. How strong are those bags? Will it pop if
no.
you roll on it or anything?
No, it won't. They're very strong. They're made of very, very strong mesh. So nothing would happen with the bags. They've never ever popped to my knowledge at all.